call the policy committee to order, and everybody is here. If you make note, have we been properly posted?
Yes, we have.
Thank you. Do we have any citizens here to speak tonight? All right, thank you. We have some action items. The first action item is approval of the policy minutes from the August meeting.
Madam Chairman, I've reviewed the minutes and find that they are in order, so I will accept the policy minutes as submitted.
And I'll second.
All right, all those in favor, say aye.
Aye.
Aye. That's unanimous.
Thank you.
The next one is revision to policy 1240, volunteers. If you will note, there are some underlined, excuse me, sentences, and a cross out on line 25.
This one, as well as the next one, are made, somewhat because of some law changes and also some procedural changes with people, non-employees coming into the schools during the day. So this just recognizes that certain people who may want to volunteer, we don't really have anyone excluding them if they have some kind of conviction or record that might impact a student. Now, we have the discretion. There was one non-related felony conviction that was like 16 years old. So we can make an exception for that because things obviously change in that amount of time. But if there's a recent issue or something that could be detrimental to students, we then have the right to say, no, you can't volunteer.
Any questions from committee? Just present.
Yeah. How would we know that someone coming in to volunteer
Background
if we don't
Yeah.
ask?
We have to do a background check if you're going to be
We
volunteering.
have to, anyone, okay.
Whether it's us or whether it's, the different volunteer organizations, whether it's a church
Okay,
or
someone was telling me, she's a grandma, and she went to visit her granddaughter's school in a different city, and she was not allowed to visit because she was not checked. And, so,
well,
that's what
visiting
I'm
is,
wondering.
visiting is different from,
Well, she was going to
Volunteering.
read some stories,
okay.
so that's a volunteer activity.
Yeah, I mean, if they're a regular volunteer,
Mm-hmm.
they do have to get
Okay,
if they're going for like Grandparents' Day or something.
Right,
typically
right.
that, Yeah.
but that person could then come in and read a story?
It would be a case-by-case basis.
Okay, thank you.
I don't want to say yes and no, I don't want to
Right,
discourage
right.
anyone, especially, if everything's all legitimate. But depending on how long they're there, what kids they're working with, whether they're supervised and so on. Many of our volunteers are working one-on-one with children,
Right,
so that's
right.
one of the differences, so.
Thank you.
Ms. Reinisch?
Thank you. Todd, do we use the we can, or do we do more than that?
Weekend's a hiring system. We have there's a Wisconsin CCAP, and then
That's
we
it.
also have a service that can go broader than that if we need to.
Okay, good, because I heard that CCAP sometimes doesn't find everything, or it's
No,
just
but yeah,
very
but we
broad.
have some other services. Now, there's a cost to use the other services, but we can use those if we need to.
Excellent, thank you.
Any other questions? All right, I'll accept a motion.
Okay, Madam Chairman, I move to accept the revisions to policy number 1240, volunteers as presented.
I'll second.
All right. Any other discussion? All those in favor say aye.
Aye.
Aye. That is unanimous. The next revision is to policy 1250, visits to the schools. And this one is in conjunction.
And this is
with-
strictly to comply with new changes in the state law. So you can see it refers to section 301.45, 1G. Basically, it has to do with registered sex offenders, and we do have some parents who fall in that category. They have to notify us if they want to come into the school. Failing to notify us gets them in some legal problems, so it's in their best interest. In certain situations, we will allow it, if there's supervision, if they're accompanied, if it's after school to go pick up a child, there are certain reasons that, that we would allow it, but by them notifying us, it gives us a case-by-case basis to determine who can and who can't come in.
Yes, Mr. Zinn.
So if a parent is, happens to be one of these people and wants to come in, if the parent advises us at least 7 days in advance, the parent could attend a conference?
Possibly, depending on the
Possibly.
situation.
Okay. Thank you.
Any other questions?
I have
Yes.
a question. Thank you. The, let's see, it would be on page 2, on the back page, and on line, starting in 24. It says, "The district and the department, agency, or person shall follow protocols established by the district on a case-by-case basis for ensuring the safety of other students." Oh, actually, I put a line there, but it actually is the whole paragraph.
Okay,
And it's talking about,
it refers to the child welfare agency of the, usually that's the county.
okay, so if there's, so that one's about the registered sex offender who is actually a student.
Mhm.
And if we have students who are expelled and they are having homebound services or at a library because of the safety of other students, do we ever use that type of service or teaching for the sex?
Homebound,
Yes,
we might, or we might use the Achieve, or,
okay,
and we are working on a different program that more or less helps or prevents expelled students, which would be an afternoon evening program, and that might be another option once we get that up and running.
okay, so I was just saying, like the expelled students, if there's a safety, if there's a cause for safety concern for the other kids,
Right.
we provide that service. What if there's a student, let's say they're 17, 16, and they're actually a sex offender?
Okay,
Wouldn't we take them out and have them homebound taught instead of having them around all the other
yeah,
students?
I'm gonna say it's a case-by-case basis,
Okay.
depending on what the, what the charge was and what the issue was. If we thought he was a danger, whether it was a sex offender or not, they would probably not be in the school. They would be receiving some kind of alternate education.
Okay. Thank you.
Any other questions? No? All right, and I'll entertain a motion to accept the changes to visits to the schools.
I will accept the revisions to policy 1250, visits to the school, as presented.
Thank you.
Second.
Good. Any other discussion? All those in favor say aye.
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 Thank you. Next revision is to policy 3450, district fund balance.
This one was kind of a late addition from the business office. The auditors wanted us to change our fund balance policy. While I think there's some important things on here, I would also like to get facilities and finance to review this as well. I think it would make a lot of sense. I don't know, I know there's some urgency to it, but I think that if, you could approve a tentative on F&F review, it could go to F&F at the next committee, and it could still potentially make it to the board in time for the financials. The urgency of the financials are, the state wants them by a certain deadline, and if they don't get them, they can potentially withhold aid, and that's not a good thing. So I guess what I would do is, if there is a motion to approve, that it would be tentative on facilities and finance review and their approval as well, joint approval.
Okay.
Any questions on the policy? Not? Someone want to make a motion to accept it?
Sure, I will. I move to accept revisions to policy number 3450, district fund balance, And also the addition of bringing this to the F&F committee for review and approval before it's voted upon.
Okay,
I'll second.
second. Okay. Any further discussion? Not, all those in favor say aye.
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 Aye. All right, that will move on to F and F. Next is policy 8230, board member compensation.
This was a request from a board member to bring this policy forward. We kind of drafted up based on some input. We had asked various board members if they had any ideas or input, and I have not heard anything at this point, so this is where it stands. I honestly don't know if it's really ready for action at this time, but I don't have any place else to go with it, because I've not gotten any further recommendations or changes on it.
Ms. Brusink.
In looking at board policy and where it states the role of committees, it appears that, board committees that is, it appears that there's a list of things that committees do not have to bring before the full board, and everything else has to be brought before the full board. And this is not one of the things that the committee can vote on by itself without having full board approval. And furthermore, if it would happen to pass, I mean, it would be certainly not in agreement with our board policy, but it would also limit the ability of the full board to adopt the committee recommendation, because usually all recommendations that come forth from board committees have to be voted on by the full board.
Mr. Aniszek, I know this was brought up at your request, so do you have any comments?
Well, Barb, if Todd had sent it out to the whole board asking for any revisions to what the draft was that he said, that he typed up for us, or that Sue did, then if no one had any concerns or any changes, does that count, or does the board vote? What did you mean?
No, that just, this is a brand-new one, and it does impact the operation of the board and might even fall under the bylaws, so that's why I asked for any comments on it. And I don't, people may have had concerns, but I wasn't asking for that. I was just asking for ideas to go forward with this. So there may have been some concerns with it, but I specifically said that I didn't want to create a walking forum or anything like that. So I said, just all I want are ideas, you know, to improve this draft. I just basically, myself and it might have been Chris Edstrom, kind of pulled this together pretty quickly.
Okay.
So,
I also have the guidelines to bylaws of the board, formulation, adoption, and amendment of board policies. That's 9310G. Number 5 in there, the Administrative Policy Committee shall discuss these proposals and recommendations with the Board Policy Committee for possible action. All policies recommended to the full board must receive a majority vote of the Board Policy Committee.
Okay.
So in order for this to move forward, this committee has to approve it
Okay.
by majority
Yeah.
vote, which would,
so you would have two options here. You can send it back for more work, for rework, if you have issues with it, to try to come up with something that might be favorable, or you would vote on it for potential approval. So those are the two, because it was put on for action in the event that people wanted to move forward one way or another.
correct.
So.
And I think I did ask board members to call me
Right.
if they had any objections or suggestions when we first sent this out several months ago. So, do we have other discussion? No? Does anybody want to make a motion?
I will.
All right,
So then I will make the motion to accept policy number 8230, board member compensation, as presented.
Okay, I'll second. All those in favor, say aye.
Aye.
No?
No.
Okay,
Or that is 1 yes and 2 noes.
correct. So that will not move forward. So hopefully if somebody has better ideas, they can bring them forth and we can try again.
Good, all right.
Okay. Revisions to policy 5141 sub 1, emergency nursing services, and policy 5141 sub 1G, guidelines for emergency nursing services.
And this one is being proposed by the Student Services Department, and I would ask Joe Cook to weigh in on this one.
Okay,
Thank you. Since the policy was last adopted, the state guidelines and requirements for school nursing has changed, including medication to students, which is the next policy that we'll be discussing. We want to make sure that what is in policy is reflective of what our practices are. Included in this policy list some of the types of training that our nurses are providing to our health room workers, and the need and requirement for the school district to provide trained medical staff, in essence, somebody who's trained to the same level of our health room assistants on field trips, and to make sure that emergency nursing services are provided, in essence, at all of our events that we're having students participate in. And again, it's to take what our practice currently is and make sure that our policy is aligned to that practice.
Mr. Zink.
Joe, what do you mean by emergency staff if you go on a field trip? Would the teacher then be designated as the emergency staff?
If the teacher were trained to the same level, and I use our health room assistants as the standard, trained in diabetic cares, trained in EpiPen, epinephrine injectors, trained to recognize allergies as is the health room assistant, the teacher then would suffice. However, if we're in a situation where we're sending students, for instance, to the zoo for the day, and we've got multiple groups that are going to be going around, we would want to make sure that we had some equivalent of that health room aide. So a
Right.
sub-aide that would go along, or we would send a health room aide along on the field trip, and then we would bring a sub-health room aide in and have a backup. We have done extensive training with staff in our school, so this really isn't an addition to what we're doing. It's just clarifying that we're going to be providing or making sure we have a trained staff person on field trips.
The reason I ask is we certainly wouldn't want to leave the health room uncovered if an aide goes along on a field trip. And so, I recall situations where kids that were on EpiPen, the teacher was trained, to give the EpiPen. So to me then, it would appear that the teacher could be the designated emergency person. Is that correct?
The teacher could be, it's part of it though is access and need on a field trip. For instance, if we were to send 3 or 4 students with diabetes on a field trip,
Yes.
in addition to have a number of kids who have allergies that would require an EpiPen,
Right.
we would want to have a second adult there who's dedicated to the care for those children while they're on the field trip. We do have contingencies planned for that if we were to have to send the health room assistant on a field trip. We have backup trained in the school to fill
Okay.
that role, and it would kind of be that domino effect.
Okay.
Somebody would fill the role of the person who's now filling in as the health room assistant.
Madam Chairman, then I think we would have to cross-reference that to field trips, because we have a field trip policy, and it doesn't say anything in the field trip policy. Lynn, could you check that on the computer? I don't believe it says anything in there about field trips, and if we're going to do that, send an emergency person along, then I think we need to state that, because it could be not, ignored
And
just because
statutorily,
it's.
we're required to do that.
Yeah,
so-
so, and if we're required to do that, then it needs to be in the field trip policy. And so then, would it be a cross-reference, or would we have to review the field trip policy and insert that language?
If it's just a cross-reference, we could place it in there, but
Okay.
if you wanted to add language to the field trip policy, then we'd have to review it.
What do you think is the best thing to do?
I think at the immediate situation, cross-reference it,
Okay.
and then maybe bring that, I think every year we should look at our field trip policy.
That-
because
yes.
That CNI has so much fun with that particular piece of the, so it might pay to look at that whole policy
Okay.
anyways, to make sure that I think there's more to it that needs to be reviewed.
Okay, so then in the motion, you would say cross-reference, and then we can, review it at another meeting, the
Yeah,
field trip.
because if we put this whole thing in, it's duplicitous, so.
Right, right,
A cross-reference at this time should
right.
be perfectly fine. Any other questions you have, any, Mr. Arnett?
No,
One more?
Yes, Mr. Singh.
Lynn, line 34, number 4, it says, ensure the each school, and I think you mean to say that. And who are we considering medical advisors? Health room volunteers?
If you're referring to line 17, a qualified physician will serve as a medical advisor for a 2-year term. We do secure, I believe it's a pro-health physician that assists us when we're drafting policies and providing training to staff. So we have an agreement currently with, I believe it's a pro-health physician for a 2-year term, and then we would, in essence, approach that person in the future and ask them if they would be willing to stay with us for an additional time.
Okay. Would that medical person then, well, I think our nurse does that when, school begins and we look at all the records of kids and we find out there's EpiPen kids and all kinds. Then I think I know the nurse trains the health room person and subsequently others get trained.
Correct.
Okay.
Our nurses are providing the training to the
Right.
health room assistants, and when they do review those medical records, the nurse is involved in that conversation and making sure that the school is set and ready to go before the school year starts.
So also, it doesn't say anything here, does it? I don't think it does, about taking a first aid kit along on field trips. And I don't know that it says that in the field trip one either. So I think we need to check on that because, like you said, you go to the zoo, somebody, has a little emergency, like a scratched knee, et cetera, and you need to wash it off, et cetera. Yes,
It's on page 2
page 2.
of the guidelines.
Okay. Oh, yes.
Line 11 talks about first aid kits on field trips.
Great.
But I
Then-
also put a reference in the cross-reference in the field trip policy to both of these.
To both of
so
those,
that-
right,
Okay.
right.
Thank
And then
you.
what about, do you take the EpiPens along? Because I remember we used to take the EpiPens along.
Yeah, for each student who has a medical need that goes on a field trip, there is in essence a field trip kit for that particular student. So for our
Okay.
diabetics, for our
Okay.
kids with allergies,
Good,
we make sure
good.
that we have the medications along on those trips.
Good, have to be careful. Thank you, Joe.
No problem.
Thank you, Lynn. So then the motion would need to say what it says, plus cross-reference for first aid kits and cross-reference for
I would just
aids going on field
say
trips.
this whole 5141-1 and 1G should be cross-referenced.
Cross-referenced.
with field trip policy.
Okay,
So do you
all
want
right,
that?
yeah, I'll make that motion.
Thanks.
All right, I move to accept the revisions to policy number 5141.1, emergency nursing services, and number 5141.1G, guidelines for emergency service, with recommendations to refer to cross-references on each one of these policies,
To the field trip.
to the field trips. Mhm.
Thank you.
I'll second.
Thank you. Any other discussion? All those in favor say aye.
Aye.
Aye. Thank you. And our last item tonight for discussion and possible action is revision to policy 5141 sub 2, administering medication to students, and 5141 sub 2G, guidelines for administering medication to students. Are you going to take that one, Mr. Cook?
I can if you'd like. Again, our policy, just to need to make sure that our policy reflects our practice and what changes have occurred over the last few years as it relates to administering medications to students. One of those areas is EpiPens, and that students are able to carry their own EpiPen if they're deemed capable and competent to do so. In addition to that, stock EpiPens in emergency situations. We're allowed to get a prescription from our medical advisor with not anybody really designated for that. It's just kind of an open prescription where we're able to stock EpiPens in our health rooms in the event that an unknown allergy pops up over the course of a day and we need to administer epinephrine to a student in a life-saving measure. This policy and the guidelines also talks about the training that's associated with it. The Department of Public Instruction has administration of medication trainings for staff members who are non-medical staff, so not our nurses, but for our teachers, our aides, our secretaries, our principals and such. There is a protocol process that must be followed, so they review an online training module. They need to be able to demonstrate proficiency for our nurses and so that they can administer a medication to students. This also does reflect the ability to administer some over-the-counter medicines, such as an aspirin, a Tylenol, ibuprofen, things like that, and then the permission that we must have on record in order to do so for students.
Okay. Question, please.
Yes.
I've seen it referred somewhere in here about glucogen or
Glucagon,
glucagon. What is that for?
that's for students with diabetes.
Okay.
And I apologize, I don't know the difference between the type 1, if it's for type 1 or type 2
Okay.
diabetics. However, our district is experiencing an increase in students with diabetes. And we are working to make sure that our policies and our practices are in place so that we can protect those students while at school.
So you take that along on a field trip too?
Correct.
Okay.
If it's required for that particular student. Currently, we're working with a number of students and families on insulin pumps and making sure that our staff is trained to help students, assist students with the various types of insulin pumps that are being used now. There's several out on the market, and we have students with several different types. So.
I have a question, Madam
Yes.
Chairman. I guess I'm gonna have to use a personal experience. I was on a field trip when I was teaching, and a child got their finger squeezed in the door, and the tip of the finger came off. And so, luckily, I was with another teacher, so that she took over the whole, we had aides along with us and parents, et cetera. And I rode the ambulance with the student to the hospital. But what if a teacher is not with another teacher? What if they're on a field trip? Who would then accompany the child in the ambulance? No one? Someone?
I can't imagine there'd be a teacher alone on a field trip.
No, I don't mean alone. I mean another teacher, another employee. There would be aides and parents.
Yeah,
That is what-
it might be that the parent accompanies a child, it would all depend.
If it's
on the
their
situation.
child.
Yeah. I mean, if a parent is volunteering, they're acting in lieu of that, so.
Okay.
I would probably ask the parent, or a parent.
A parent,
volunteer
okay.
to accompany the child, and then.
Rather than the
would-
teacher?
that's-
Okay. Because this child was, extremely emotionally upset and didn't want to go with the aide, so,
And again, the chaperones
went.
have to meet the same volunteer criteria, so.
yes, I understand that.
it-
Okay, I just wanted to double check with you. Thank you.
Do you have any questions, Mr. Rizzo? No? Any other questions, Mr.?
No.
Someone like to make a motion then to accept the policy revisions?
I'll make the motion to accept the revisions to policy 5141.2, administering medication to students, and 5141.2G, guidelines for administering medication to students, as presented.
Second?
Okay. All those in favor, say aye.
Aye.
That's unanimous. We have no information items, and do we have any other policies that anyone wants for revision for a future meeting?
I think the field trip.
The field trip? Okay, we'll look at that.
Yeah.
I don't know if we'll have it ready for November meeting.
That's
but
okay.
We'll look
Oh,
at
I
it.
would think we could. I imagine it's just a line in there plus,
What was that?
cross-reference, the
Field
field
trip.
trip policy to add the
The ones that we
cross-reference
made the,
in reference to it.
I believe we discussed that cross-references just to other policies don't require committee or
Oh.
board action.
But they're
Oh.
asking maybe putting in a line or two to note this, I mean, so it calls attention to it. 'Cause
Oh,
often,
in addition to the
people look at the policy, but
Right.
not necessarily the,
So would you like to look at that policy at a
for
future
field
meeting?
trips. Mhm.
Okay. We have a field trip policy and we have a student overnight trip policy and guidelines that go with the both of them. What do
Okay.
you recommend?
All right, We better look at both of them.
That's a total of 4 policies, policies and the guidelines. Okay, will do, thank you.
Yes.
So so going back to that policy, if the committee does not vote a unanimous vote, then it does not go to the full board?
If it doesn't receive a majority vote. Now, that doesn't mean it can't be revised and brought back to this committee, which is what I had said. That was one of the possibilities, if someone wants to make some recommendations for revisions so that you're voting on that policy number, but a different format, you can do that, but I didn't hear that, so.
I thought our board president talked about if anything was in a committee.
That is true for everything but policy.
Oh, okay.
See, this is a
That's,
policy issue.
and that's actually in the bylaws, so, a policy is, technically like one of the laws of the school board and for the district to follow, so I think that probably, there's a little bit higher standard to make a policy. Most policies typically need a 2/3 vote. If you want to suspend any policy, that needs a 2/3 vote. So I'm guessing there's a higher level of scrutiny, which is why the bylaws are written that way.
So as is, the board could vote on a $20,000 pay raise without the public's notice, and as it stands right now, that's okay.
Well, you'd have to notice that, board member compensation is
On
going
the
to be an
agenda.
action
On the
item.
agenda, yeah, it would
Oh,
be
yes,
agendized.
yes,
Yeah.
absolutely.
Yeah.
But if they could vote that it could be any amount at this point. That's what
Yeah.
you guys,
Yeah.
that's the way it's gonna
Just
go?
like
If
it
you got a motion and a second to the amendment, you could vote on it. Whether that vote would be successful or not, I would probably guess no, but you could do it.
Yep, just like it was. Okay, thank you.
Okay, our next meeting is Tuesday, November 18th at 6 PM. Thank you very much, and we are adjourned.